Hi, and welcome to Public Health Spotlight. My name is Tammy Griffin, Public Information Officer for the Wicomico County Health Department. Public Health Spotlight is a program that highlights the variety of services available to community residents through the Wicomico County Health Department. Joining us today is Denise Chamberlain. Denise is a registered nurse with the colorectal program at the health department. Next to lung cancer, colorectal cancer claims more lives in Maryland than any other form of cancer. This is according to the Centers for Disease Control and Prevention. Colorectal cancer is actually the leading cause of cancer deaths in Maryland, and if caught early, it is curable 90% of the time, but the trick is getting tested. So Denise, welcome. Tell me, if I were to be a client of yours and ask you what exactly is colorectal cancer, what would you say to me?
Well, I would actually tell you that colon cancer is a cancer that forms in the large bowel or the colon and rectal area, the area of the body that actually gets rid of waste after it's part of your GI tract, and it's the part of the body that the waste that your body doesn't need gets rid of. And so I would tell you that, and that.
How does the cancer form inside the colon? How's it identified? Do they look for certain things?
Yes, actually, when you have a colonoscopy, the physician is looking for something like this that is called a polyp. It's an overgrowth of tissue that can form in the colon for whatever reason. These polyps sometimes form in people, and normally what the American Cancer Society is recommending that anyone age 50 or older have a screening colonoscopy to identify if they are going to be one of these people that is going to form these types of polyps. Some of these polyps, if they're left in the colon forever, may never turn into colon cancer, but there's other ones that if they're left there, they could turn into cancer. So this is one of the greatest ways that we can prevent this type of cancer from happening if we can remove these polyps like this before they've had a chance to turn to cancer.
Who would be at the greatest risk of developing?
Well, normally anyone that has a family history, a strong family history of colon cancer, if you've had a mother or father, sister, brother, or child that's ever had colon cancer, if you're someone that already has had colon cancer yourself, or if you have ulcerative colitis or Crohn's colitis, one of those type of bowel diseases, that would put you at increased risk. If you're a woman and you've had endometrial cancer before, that could put you at increased risk. And those people that are over age 50.
Okay. Are there certain warning signs or symptoms that people should be looking for?
Well, honestly, there are no early warning signs for colon cancer. There's many people that go through and have colonoscopies done and do have cancer and have had no symptoms. But there are some symptoms that do need to be checked out, whether you're 50 or not. Things like bright red blood in the stools, or change in your bowel habits. And I tell my clients, BMs that come out looking long and narrow like a pencil, unexplained weight loss, or any type of lower abdominal pain. Those types of things need to be checked out, and they can be symptoms of colon cancer.
Okay. Is there a particular type of screening that's recommended?
Well, the American Cancer Society's gold standard is the colonoscopy, and that's in fact what we at the health department do help our clients get, the screening colonoscopy.
Okay, Denise, what type of screening is recommended?
The American Cancer Society recommends the colonoscopy as the gold standard for screening people age 50 and above.
Okay, and some people may feel like there's a little bit of a stigma to that sound when they hear colonoscopy. What does that actually entail?
Well, actually, it's a very simple procedure. The worst part of the whole procedure itself is the preparation, and that's the procedure you have to do the day before. Actually, the colonoscopy, people are normally put to sleep nowadays. Now, they do give some clients what they call conscious sedation, or meaning that they won't remember the procedure. But most of the time now, physicians are actually using sedation, and the patient is actually asleep when they have the colonoscopy. So I tell my clients, you're asleep and awake before you ever even know, I mean, it's completely done and over with. Like I said, the preparation itself is probably the part that is most difficult for clients, and it's because the day before they have to be on clear liquids. They do have to start in the afternoon drinking like a gallon jug of laxative solution, and that doesn't taste the best.
That's probably the hardest part.
It is very difficult for some people, very difficult. And then after midnight, usually they're nothing by mouth. But then when they have the colonoscopy, like I tell my clients, when we send our clients to have a colonoscopy, I tell them that when you go there, normally they get you to change into a gown, they start an IV, they take you back in a little room, they lay you on a table, put you on your left side, they may put a little oxygen in your nose, and then they tell you good night, and usually that's it. So you're completely finished with that. So really and truly, the worst part of it is just the prep the day before and being on clear liquids, because you get very hungry.
And how long does that procedure actually take?
The actual procedure itself only takes about a half hour, 45 minutes at the most, and that depends on if you have polyps or not. If you don't have polyps, then, you know, like I say, it will take much less time, because the doctor does have to take time to remove the polyps. You may have other conditions too that the doctor might identify. You might have this ballooning of the bowel that is called diverticulosis. The outpouching of the bowel, and sometimes that tends to happen to people either because of heredity or our diet, because we don't have enough fiber in our diet that makes that more people more susceptible to that. But that is not something that is a precursor or causes colon cancer. Or they might have, you know, the rectal bleeding may be coming from a hemorrhoid or something like that, which is just like a varicose vein there in the rectal area. And that too, it doesn't, it's not a precursor for colon cancer.
Okay, so if then the physician does identify polyps while conducting the procedure, then they do actually go ahead and remove them?
They try to. If the polyp is small enough, they try to go ahead and remove it right while they do the colonoscopy. And then they send it to a lab to be analyzed. And there are different types of polyps. And the way that I explain it to my clients is that a hyperplastic polyp, which was a simple name, which is what I say are really benign polyps, meaning that there's the type that could, if they stayed there forever, probably would not turn into any type of cancer. But then there are other types called adenomas, and they're the type that are what we consider precancerous polyps, or polyps that if left there could possibly turn into cancer. They also have different degrees to them. So a tubular adenoma would be the least advanced, and then you would go on to a vilotubulus or a villus, or, you know, that type of thing. So they can get more advanced. But those are the type that we want, you know, to make sure that they are removed before they've had a chance to turn to cancer.
So what then is your responsibility at the health department as far as making the connection between the clients and the physicians? How do you kind of fit in that picture?
Well, actually, the way that our program works, we have a grant there through the Cigarette Restitution Fund that does allow us to have some funding for clients that meet eligibility criteria in the community to get screening colonoscopies. They need to be at least 50 years of age or older, or they need to have a first-degree relative that's had colon cancer or have one of those other conditions that would put them at increased risk. They need to be a Wicomico County resident, either uninsured or underinsured. I do want to put a plug in here though. There are many people out there that do have health insurance, and they do have the preventive type of thing on their health insurance. They may have a high deductible or whatever, but they do have preventive services under their health insurance, and a lot of these people are not being screened because they don't feel that they have the coverage. But they really should check that out, because that is one of the greatest things. You know, for women do the mammogram, you know, yearly and that type of thing, but oftentimes people are not taking advantage of the insurance coverage that they do have to get this colonoscopy screening once they've turned 50. And also that they meet the eligibility criteria income-wise, because our criteria is 250% above poverty level. So it's not the poverty level itself, but people can make, and that depends on the number of people in the household.
How would someone know if they would qualify for the program at the health department?
Well, actually, they can just give me a call at the health department if they have a question. But most of the doctor's offices and different places in the community, I do try to make sure that I have information out in the community so that people will know who to refer to our program. And it doesn't make any difference, even if they don't qualify for our program, they're more than welcome to call me, and I will try to help them in any way that I can, yes, as a resource.
How do you kind of get past the whole fear that people may have, or the stigmatization of when they think of colonoscopy? You just kind of, sometimes you might get a little bit nervous about it. How do you, when you get phone calls of people who may, be, I'm not sure if you've had that, I'm assuming that you probably have, how do you kind of work people through that process and make them feel comfortable?
Well, I actually try to give them as much information as I can give them. And I try to bring it down to their level. I try not to make it so medical and so technical. I actually have been commended because we have a higher number of men that come through our program than some of the other programs in the other counties. And I think it's just because I've been very honest with them. I do kind of hold their hand and really answer all of their questions and just try to give them that reassurance. Once one has gone through it, then they go out and tell their friends, and they'll tell them, they'll say, call Miss Denise, she'll help you through. And I do try to help them, even if they don't qualify for our program. I try to give them information and help them with resources so that they know where to go.
Now, I know that the health department does a lot in the ways of prevention services. What are you doing to kind of get the word out to the community and educate people about prevention ahead of time?
Well, actually, one of the greatest things we do is we promote Colorectal Cancer Awareness Month, which is March, which the kickoff for that is the first Friday in March. We all dress in blue, and that is actually the Colon Cancer Alliance is the color that they've actually chosen to be able to promote. Just like we do breast cancer, October is pink, we're doing March, which is blue, and it just gets us started getting people to talk about colonoscopy screening, prevention, that type of thing, getting them to talk to their family members, their friends. We try to get businesses on board and other agencies that we can make it a fun time to be able to talk about something that sometimes is not quite so easy to talk about, but we need to for our health's sake. I'll go out and do presentations at local churches or different businesses in the community. Any place that I can get the word out, I will try to go.
Great. That sounds like fun.
Yes, absolutely. We have a good time with it at the health department.
I know at the health department we do. We get lots of the staff involved and go around and take pictures of everybody.
Yes, and we have little stickers that we give out that say, ask me why I'm blue. And, and when people ask you, why are you blue? Well, it's because this is Colorectal Cancer Awareness Month, and we want people to start talking about that because it is the second leading cause of cancer deaths in the United States. And, people need to not be ashamed, but they need to take care of their health and actually do the preventive things that will help them to be here for many years.
Yeah. Thank you so much for joining us today.
Thank you very much.
Thank you so much for joining us on Public Health Spotlight. If you have any questions about the information provided in today's programming, please feel free to call the Wicomico County Health Department at 410-543-6938. Once again, we thank you for joining us, and we'll see you next time right here on PAC 14.